Well, we are continuing to uncover information about a Northland nursing home where an Alzheimer's patient walked away Sunday afternoon. Searchers found George Messiah's body in a ravine 2 miles away from the Cherry Hills Community and Rehabilitation Center. Investigator Melissa Yeager keeps digging into the facility's history. She joins us now with new information. Melissa?
Well, tonight we have our hands on 2 lawsuits filed in Clay County Court against the Cherry Hills facility, both filed within a month of each other last year. The lawsuits accuse the facility of negligence, and some former employees we've spoken with also make the same accusations.
If that was my loved one in that home, I would hope somebody would come forward.
A former supervisor at Cherry Hills Community and Rehabilitation Center didn't want to show her face, but did want to share her concerns about what she saw at the facility during the 6 months she worked there. You thought this is something that could happen?
Yeah, I knew it was something that could happen because the ankle bracelets rarely worked 100% of the time. They knew that.
She told us she resigned over her concerns in January. After airing her interview last night, we've heard from more former employees of the facility who support her claims. We also uncovered 2 lawsuits filed in Clay County Court, both over deaths of patients in the facility. One filed in February of 2011, the other filed 1 month later on March 23rd of 2011. One lawsuit discloses few details, but the other alleges the patient died 4 days after she fell and received a head injury. The suit alleges the facility failed to adequately supervise, monitor, and treat her. Steve Keeker runs Senior Care Consulting, a company that helps people research the right nursing home. He told us today 2 lawsuits over patient deaths raises concerns.
That's a significant and very poor track record. It's not the norm at all. This is not normal.
It would be a red flag. We're not out of bounds saying it's a red flag.
It's definitely a red flag, in my opinion.
Since I left, there are still times where I think about all those patients, and I worry.
A spokesman for Cherry Hills gave us this statement, quote, "The fact is all of the doors in the facility are and have been equipped with alarm systems. We are currently working with authorities to determine how the resident was able to leave the facility despite having alarms on all of the doors." And after hearing from several of those former employees who backed up the claims of that nurse, we contacted that spokesperson again, and he says the company stands by his statement.
Quite a story. Keep digging. Thank you very much, Melissa. Well, experts say many people make the wrong decision about a nursing home simply because they wait too long to decide to move a loved one into a nursing facility. They say you should move to a nursing home when it is no longer safe to live at home, when the health of the caregiver is declining, when home care becomes unaffordable, and you should move someone to a nursing home when you just can't provide enough care. Experts say if you start early, you'll have much more time to research the right facility rather than being in an emotional state. Now, we put links to researching nursing homes on our website, kshb.com.